Hello, it's Rebecca Morang here. I welcome you back to this channel where we talk about the basic medical information making a big difference. I want to extend a request. If you have been watching this video or videos from the start and you have not subscribed, kindly choose to subscribe and hit the notification bell so that you get to be notified each and every time I upload a new video. And for those who have already subscribed, thank you so much. Again, we have been talking about the thyroid and we have looked at several subtopics on the thyroid. Now, today we are going to look at another disorder of the thyroid, which we call the thyroid nodules. Now, before we get to know more about what are they, if we can define them, what are thyroid nodules? These are solid lumps or fluid-filled cavities within your thyroid gland. How are they diagnosed? You have a thyroid nodule. How does the doctor now come to a conclusion to know that you have the thyroid nodule? There are several ways thyroid nodules can be diagnosed. One, it's through physical examination. Now, how is it done? If you remember, we have been talking about the thyroid. We looked at hyperthyroidism. There are some physical examinations or physical symptoms you can get to see. One, we said it's tremors of your hands, all your fingers. So if you have a thyroid nodule, which is producing hormones, actually, hyperthyroidism can be caused by a nodule in your thyroid. So if you have a thyroid nodule, there are high chances of you having a condition we call hyperthyroidism. And here you will find that some people have tremors, some have irregular pulse or heartbeat. So those are some of the physical. The doctor can decide to use what we call thyroid ultrasound, and this is the best way to determine. Why do I say so? Here, the high frequency waves which I use can be able to show the shape of the thyroid nodules and can even show the size of the nodule in centimeters. And it can distinguish between a solid nodule and a cyst. Again, the thyroid ultrasound actually can guide some further diagnostic procedures. Which one is this? What we call fine needle biopsy or fine needle aspiration biopsy. What happens here? They can be able to use a thin needle, that is how it's done, and then they will inject at the nodule in your thyroid and remove some sample cells which will be taken to the lab to be checked whether they are maybe benign or malignant, whether they are cancerous. And again, they can use what we call blood test. Here, a blood sample is taken and then they'll get to see the level of thyroid stimulating hormone and the two thyroid hormones, that is T4 and T3. Another diagnostic procedure is what we call thyroid scan. It's an isotope of radioactive iodine which will be injected into a vein in your arm. And then you are made to lie flat, maybe on a table. And then the computer, some special camera will show the shape of your thyroid through a computer screen. Thyroid scan, they can be able again to know whether the nodule is either a hot nodule or a cold one. A hot nodule means it's producing extra thyroxine, thyroid hormones, or more thyroid hormones. That is what you call a hot nodule. And a cold one is the one which is not producing any thyroid hormone. So those are some of the procedures which can be used to diagnose the thyroid nodules. Now, how are they classified? 4 classifications: a single nodule, multiple nodule, and then what you call cysts, and then solid nodule, which can be either hot or cold. Now, let's move on. What are the symptoms now of these thyroid nodules? If the thyroid nodule is bigger or big enough, it can be seen. You can be able to see it. The doctor sometimes, I remember telling you, can decide to tell you to swallow saliva. The thyroid will move up and down. We looked at the anatomy of the thyroid gland. It moves up and down. As it moves, the doctor can be able to see if there are some lumps which are irregular in shape on your thyroid gland. So it can be seen, or it can be felt by touching. You can be able to see if it's hard or a soft one. You can get to feel it. So those are the some of the ways or the symptoms which you can see in somebody who has these thyroid nodules, alongside what I've mentioned of the hyperthyroid symptoms: being nervous, being irritable, all having an irregular pulse, all heart beat. So what are the causes? What causes now these thyroid nodules? Somebody can ask, what causes this? Actually, many people do not even know or realize whether they have these thyroid nodules. They can only be discovered when you go for a routine examination. Some people do routine checkups, maybe on a yearly basis, maybe twice a year. So it depends with an individual. When you go for these routine examinations, by good luck, as you do those examinations, doctor can get to see that you have those nodules. So it's very difficult actually to know that somebody has got thyroid nodules. So it's not easy to know. Some people get these symptoms you have talked about of hyperthyroidism, hypothyroidism. So even the diagnosis becomes sometimes difficult. You may go to the hospital, you are told you have this condition, but sometimes we have what we call wrong diagnosis. They start treating something different before actually get into the right diagnosis. So it's difficult to know that somebody has got the thyroid nodules. Get that point clear. How are they caused? That is the question we're going to look at. The causes are many. They can be caused by what we call iodine deficiency. When you have less iodine in your diet, that one can cause thyroid nodules. When you have what we call multinodular goiter, what is that? Multinodular goiter is when you have multiple nodules in your thyroid gland. And remember, goiter, we said, is the enlargement of the thyroid gland. So when you have multiple nodules in your thyroid gland, that is what we call multinodular goiter. So those one can cause the thyroid nodules when you have a goiter in your thyroid. And then they can be caused by thyroid cancer. We have what we call cysts. You have mentioned them. Fluid-filled cavities in your thyroid. Those ones can cause these thyroid nodules. So those are some of the causes of thyroid nodules. And actually there is what we call thyroid adenomas, which are non-cancerous. Outgrowth of thyroid tissues in the thyroid gland. They can lead into thyroid nodules. What are the complications? Are there complications which are caused by thyroid nodules? Yes. Which are they? One of them is pain when you swallow, because now they are pressing, the nodules are pressing on your esophagus. Now, as a result, you'll get a lot of pain. And also, some people get shortness of breath because their nodules are pressing on your windpipe. That is one complication. Another one, it's because of the hyperthyroidism symptoms. Those are complications. Being nervous, irritable, tremors. Those are some of the complications, because we'll have to have such like conditions. So if you have those nodules which are producing extra hormones in the thyroid, they will bring what we call hyperthyroidism symptoms, which are complications brought by thyroid nodules. Again, there is another complication where maybe in the treatment, maybe you look at the treatment of the nodules later. How are they treated? If the doctor decides to do what we call thyroidectomy, we mentioned the removal of the thyroid gland, the whole of it, the complication which will have is to take anti-thyroid therapy, all drugs, the whole of your life, because you have your body needs thyroid hormones. So if the thyroid gland is removed, you have to be in a long time thyroid medication in your life. So those are some of the complications which are brought by the thyroid nodules. Now, again, something to top up. When we talked about the fine needle aspiration biopsy, where we were looking on the way thyroid nodules are diagnosed, actually, after getting these samples, the cells, the samples are removed and then which are taken into the lab, they can be able to tell whether the thyroid nodules is cancerous or non-cancerous. They have different ways of getting to know or to classify those nodules. So at least up to this point, I believe we have gotten something on thyroid nodules, which is a disorder of the thyroid gland, or one of the disorders of the thyroid gland. So you can be able to differentiate now thyroid nodules from a disorder we call the hyperthyroidism, because we have talked about that. If you forget everything, at least get to know what are thyroid nodules. What are the ways to diagnose these nodules? How are they classified? What are the symptoms? Are there physical symptoms you can be able to see, of which you have mentioned about? It can be felt, it can be seen. What are the causes? What causes these symptoms? What causes these thyroid nodules? And then what are the complications of thyroid nodules? Thank you so much for always coming to check on my videos. And remember, I said when I started, if you have been watching these videos and you love them and you enjoy them, kindly choose to subscribe so that we get to move along. And I promise as we move on, I'll be able to create more content which will be better each and every day. Because where he started from in this channel, we have moved some steps. And now, as you choose to subscribe, you are going to get more content, more improved each and every day. For the returning subscribers, I say thank you so much for always coming back to watch my videos. Kindly give the video a like, give it a thumbs up. Don't forget, give the video a like, give us a comment. Have you ever heard of the thyroid nodules? Have you ever seen somebody with thyroid nodules? Have you ever come across this information? In this channel, we are here to give information. We don't treat. We only give information which will help you. If your loved one has got this symptom, he or she will be able to make the right decision. And remember, information is power. When you have the right information, you are at the best place. That is why I always say, this is the channel, or this is the best place to be. Thank you so much. Let's meet in the next video. Thank you. Bye bye.